Continuing our assessment of the head and neck, let's look at the ears. First, we'll look at the auricle and pinna, that funnel-shaped area on the outside of our ear. Although our objective assessment will focus mainly on the external ear up to the point of the tympanic membrane, or eardrum as we commonly know it, we still do want to ask them subjective questions about things like earache or pain, any excessive cerumen buildup or wax buildup as they may know it. Any recent infections. If they're an adult, did they have childhood infections? These could often cause us to see scarring within the tympanic membrane. Any sort of trouble hearing. Are they exposed to anything on the job that would be loud, or do they listen to loud music? Any ringing in the ears or tinnitus. Vertigo, which is room spinning. Also, we want to take cues from their talking to us. Do they appear to be lip reading? Are they leaning into our conversations? Now we'll begin our objective assessment of the external ear. First, begin by inspection. Note the size and contour of the auricle. Look at the symmetry of the auricles to each other as well as the alignment with the eyes. Remember, in people that have Down syndrome, the auricles will be lower than the eye. Next, palpate along the auricle and especially the ear lobe, in front of the ear and behind the ear for any pain or tenderness. To visualize the tympanic membrane that separates the outer ear from the middle ear, we'll use an otoscope. We hold the otoscope in the same way in which we did the ophthalmoscope. If we're looking at the right ear, we hold it in our right hand. We straighten the ear canal for patients 3 years and older by pulling the auricle or pinnae up and back. For children less than 3 years of age, we pull the pinnae or auricle down and back to straighten the ear canal. As the otoscope progresses through the ear canal, you will notice cilia, the fine hairs that line the ear canal. These can become thick and coarse for the elder adult. You will also notice cerumen. This is the waxy buildup. This can be anything from thin, clear to yellow, or thicker, more waxy buildup. It is normal within stated limits, but as it builds up more, it can impact hearing. The goal of the otoscope examination is to visualize the tympanic membrane, or the eardrum. This is the layer of membrane that separates the external and middle ear. It should appear pearly gray. The last exam that you'll perform for the ears is the whisper test. With the patient sitting on an exam table or chair, stand an arm's length away, approximately 2 feet behind the patient. Tell the patient, during the hearing test, I will ask you to cover the ear that is not being tested as I say letters and numbers out loud. You will cover your ear by putting your finger over your tragus. Next, have the patient cover the ear that's not being tested with one finger over the tragus. Have the patient slowly move the finger in a circular motion over their tragus. Take a deep breath and exhale fully before whispering the number and letter combination. Give a number, letter, number as listed below. Ensure that the number, letter, number combination is different for each ear. Have the patient repeat what they hear. If the patient successfully repeats, move on to testing the other ear. If the patient is unsuccessful, reattempt testing with a different number, letter, number combination. If a patient gets 3 total letters and or numbers correct after a second attempt, it is considered a pass.